Hi, my name is Zoe Van Swan. Here's my paper, and it's the 11th of August. And this is my video presentation for the Unit 2 case connections case exams. Okay, so for my first case, I picked case 4 to discuss. Case 4 talks about a previously healthy 2-month-old female presenting with jittery spells after breastfeeding, has only had breast milk since birth, and lab results show consistent hypoglycemia. Epinephrine does nothing to increase blood glucose. Hepatomegaly on physical exam. Basically, it's asking which of these diagnoses would most likely be accurate for the patient. A, hereditary fructose intolerance. B, galactosemia. C, glycogen storage disease. Or D, glucose 6-phosphate dehydrogenase deficiency. And I picked that C, GSD, or glycogen storage disease, is the correct answer for this patient. And my answer, based on the information given in the scene for case 4, the baby must be suffering from C, glycogen storage disease. It is a rare disease in which the body cannot use enzymes to break down stored glycogen into glucose as a fuel source, especially during fasting. Let's see, especially during fasting. One of the main symptoms found during physical examinations are hepatomegaly or an enlarged liver, which this 2-month-old patient does present with. It also states that the patient gets increased blood glucose levels after breastfeeding, but is hypoglycemic and cannot maintain normal glucose levels during fasting states. That's super important in order to prove that this is the right answer because, like I said, glycogen is broken down in the liver to produce glucose, like during fasting when we are not actually consuming glucose directly, in order to act as a fuel source for the body. And then so this saying that she has normal glucose levels during or right after she eats, so this is like the glucose that she consumes, but when she's fasting, she's hypoglycemic because none of the glycogen that should be stored in the liver is being broken down into glucose. And then another important part that was mentioned in the case is that epinephrine is administered and there's no increase in blood glucose. So epinephrine is a hormone that is secreted by our adrenal glands, and it's important when we are hypoglycemic because it stimulates the breakdown of glycogen into glucose. So therefore, if there is no change in glucose, therefore glycogen is not being broken down. And then so epinephrine is not affecting this pathway that is occurring in a healthy patient. So I went down the list. So A, for hereditary fructose intolerance, cannot be a choice since this condition has to do with a specific sugar known as fructose, which is mainly found in fruits and juices. And as stated in the case, it says that the mother reports that the baby has not had anything to eat other than breast milk since birth. And so fructose is not found in breast milk. Therefore, this is a sugar that she has not been exposed to yet, and we cannot say that this is a condition that she has at this time. And other symptoms include nausea, vomiting, like abdominal bloating, stuff like that. It's kind of like being lactose intolerant, but with fructose instead. But she has not been exposed to this. Therefore, A is not a plausible answer. B, for galactosemia, I said it is not the answer because galactosemia usually leads to failure to thrive because galactose is a really main sugar or important sugar that is found in dairy products, so breast milk. So since babies are literally exposed to milk from the minute they're born, it's kind of, you're quick to realize that if a child has galactosemia, and due to this they have very poor weight gain, failure to thrive, etc., which is not mentioned in this case, so therefore I eliminated that answer. And then Option D, glucose 6-phosphate dehydrogenase deficiency is incorrect. Well, for short, G6PD deficiency is incorrect because it has to do with red blood cells. And again, this has nothing to do with red blood cells at all. It has to do with sugars. So that just in itself you can eliminate. But to go further into it, it's a hemolytic anemia. So red blood cells are destroyed faster than they can be produced. So symptoms would be like jaundice, paleness, fatigue, shortness of breath, pancytopenia, things of that nature. So that is case 4, and the other case that I picked was case 3, which is going to be a 5-year-old boy is brought to the peds office for an annual visit. She reports that he's very sickly infant, drowsy, frequent urination, persistent thirst, and then it has a table of the patient's insulin levels. So it says, what is this information likely to suggest about the underlying biochemical basis for the patient's symptoms? The information, so my answer is the information on the chart along with the information from the patient's mother suggests that this patient most likely has early childhood type 1 diabetes. According to the chart, which shows that the insulin level is low in both baseline and after glucose load, like significantly low, this would mean that their fasting blood glucose levels would most likely be above normal range. So type 1 diabetics have very low insulin levels to no insulin levels due to the pancreas not producing insulin. And insulin is the hormone that the body uses to remove glucose from our blood and then bring it into cells to be used as fuel or to be stored wherever need be. So if your insulin is low and you eat, just a regular meal, your glucose levels are going to be extremely high. And even during a fasting state, since it was never used up or picked up by the insulin to be brought into your cells, it is you're still going to have above average, baseline blood glucose. Like I know type 2 diabetics, at least their normal range is always above 100. And like 110, 120, it depends on the person, but that's normal to them. So in this case, I'm sure his insulin level or his glucose fasting level is elevated. And then I continue on to say that the symptoms of polydipsia, which is excessive thirst, is due to too much glucose in the bloodstream, and polyuria, which is excessive urination, it is a combination of people attempting to quench that thirst, so they're drinking more and then urinating more, as well as the kidneys are just trying to remove the excess glucose that is in the body, which is very damaging to the kidneys because it is a macromolecule. It's not meant to be filtered out through your urine. So as it is being filtered out through your urine, it's pulling a lot of water from your body along with it, also dehydrating you even more. So that is my answer for that. And list 2 regulatory enzymes that are likely to be active during this patient's condition. So during this hyperglycemic state, I said there's a lot of regulatory enzymes active, but I just listed glucose 6-phosphatase and glucokinase would be 2 that are active at this time. So that is my answer for case 3, and then I have my sources listed at the bottom. And yeah, that is it.